Hey, welcome to the studio, Dr. David Klein of the Stages of Life in nearby Longwood. And, Doctor, we're going to be talking today about arthritis. What is arthritis?
Okay, well, arthritis is sort of an interesting complaint. Okay, it's a description really that means inflammation of the joint. Okay, now that's all it means. It means nothing more, nothing less. Arthritis is inflammation. So the real question that people have isn't so much as, gee, do I have arthritis? Because they already know that when they move their fingers and their toes that they hurt. The shoulder hurts a bit. So you know that you have inflammation. You know that you have pain. You know that something is wrong with the joint. But that's where it stops, okay? There are many different types of inflammation. There are many different types of arthritis. So you can have an arthritis or inflammation in the joint due to infection. Okay, so infectious arthritis, very commonly seen with gonorrhea, believe it or not. So somebody comes in with a monoarticular arthritis of the knee. One knee swells up, the rest of the body's doing okay. You better start thinking about GC, because gonorrhea can cost that individual the use of their leg. Now,
Wow.
Does that happen commonly? No, but it's something that a doctor should keep in their mind, and it's one of the many reasons why you don't want to go without medical care when something happens. You can tough it out, but should that happen, and you got 2 or 3 days, or you're going to lose the use of your leg. But far more commonly, the differentiation is between osteoarthritis, which is degenerative. You've got old person's arthritis. When does this start? About the age of 15 or 16. It progresses until they stick you into that box. Rheumatoid arthritis is autoimmune. And there are many, many different autoimmune arthritis other than rheumatoid. So you can have autoimmune thyroid disease. You can have autoimmune adrenal disease. You can have lupus. You can have Sjogren's. You can have MS, oddly enough. And all of these are associated with arthritis to one degree or another. They're all treated differently, but they're all pretty much the same thing. Well, what else can cause arthritis? What else do you have to worry about? What do you have to concern yourself with? The structures surrounding the joint can in fact become dysfunctional. They can become damaged. They can move the wrong way. They can bind the wrong way, thereby causing arthritis. Where do you see this? Very, very commonly in the knee. So if you have an ACL tear, or if you have collateral ligament tears, the joint will shimmy almost. And the net effect is the same on the knee joint as it would be if one of the tires in your car went out around, and it would knock your suspension out. The difference is that replacing a knee is a whole lot more complicated and certainly more expensive than replacing a tire or getting your tires balanced. So how do you go about differentiating between the different types of arthritis? Because that's really all you're going to really care about now is, well, let's look at my fingers, let's look at my toes. Is this rheumatoid? Because I had an aunt that had rheumatoid, and I had a sister or cousin or whatever that's always worried about rheumatoid. When you're looking at your fingers, okay, if the distal joints, the last joint in your finger and the joint adjacent to that become inflamed, these are called Haberden's nodes. Okay, Haberden's nodes are typical. In doctors, we call it pathognomonic, but they're typical of osteoarthritis. So when somebody comes in and they have old person's hands, okay, and they're a little gnarly looking, and that's where you sit back and go, yeah, that's okay. You're not going to get yourself into any trouble with this. You earned that arthritis. Okay, that is wear and tear. You wore and tore. Enjoy it. There are some tricks we can do to make you feel better, but you don't need to worry about it. But when the fingers start to deviate towards the ulnar side, which is the little finger side of the hand, then you start thinking in terms of rheumatoid. Okay, it's very characteristic that. Or if your arthritis is of the knuckles, that tends to be rheumatoid in nature. And you have to do your workup a little bit differently. Now, is it always the case? Nothing is always the case.
Mm-hmm.
Okay, so always consider everything.
Is that what it is when you see somebody's hands and they look like they're crooked?
Yes. Okay, it's exactly it. But they're typically crooked towards the ulnar side.
Right.
Okay, so the hands will deviate. We call that ulnar deviation. The index finger, your pointer finger, is now pointing a little bit towards the little finger instead of towards the thumb or straight ahead. But the treatment is very, very different, yet it's the same. What you're looking to do is deal with the underlying autoimmune disorder while controlling the inflammation and shutting down further destruction. Because when the joints stay inflamed, okay, so you're going to look at it and you go, oh my God, this hurts. I'm going to take a pill. I feel better. That's not it. Okay, all you've really done is put a Band-Aid on an arterial bleeder. It's not really very good, very clever, or very effective in the long run. What you need to do is to shut down the autoimmune disorder, and that doesn't mean use an $80,000 a month biological. What you do is have to figure out why your body or your wife or your cousin's body broke down. And it's almost always, but not always, a nutritional issue. Now, I'm not going to be out here selling super beets. That's really stupid. But what happens is people will end up with dysfunctions of their immune system as a result of micronutrient deficiencies that are almost always mineral. Okay, what does this mean? It means it's cheap to fix. Okay, you're looking at zinc and selenium as the principal deficient minerals. You go ahead and you start replacing them. People do better. But then there are more interesting problems, and that there are issues of insulin glucose balance. Now, you'll hear people go out there and render the following opinion. Well, sugars are pro-inflammatory. Now, the fact that they have used polysyllabic terms shouldn't impress you very much, okay? Because usually they know the words, they don't really know what they're talking about. Yes, it's true. Simple carbohydrates tend to make inflammation worse, but why? Okay, the answer is very, very simple. It's by inducing the increased level of insulin, which is actually the actor, not the sugar itself. So if you have high levels of insulin floating around in your system, your doctor will say you're pre-diabetic. They give you something that's going to deal with the blood sugar. They're not dealing with the underlying issue, which is insulin being the agent. Insulin is bad news when it comes to arthritis. Insulin is bad news when it comes to chronic illnesses. Insulin is bad news if the ratio of insulin to glucose isn't low. You want to have as low an insulin as possible relative to a normal, healthy blood sugar. That is the issue. Mm-hmm. So how do we treat it?
Yeah.
What do we have to do? So how are we going to take care of that shoulder of yours, your toes, your fingers, your hips? Well, oddly enough, they're different. Okay, different oral medications hit joints differently. So if you think you're taking one anti-arthritic and that's sufficient, you're probably sadly mistaken. Okay, certain joints do better with certain prescription medications. Meloxicam for sacroiliac joint is the first one that comes to mind. If you're going to go after the knees, diclofenac behind the knees transdermally works better than anything else that I know. But these are prescription items, and they require a physician that knows what's going on. Those are two difficult things to put together sometimes. So what do we do? Well, the first thing that we do is that if you're convinced that what it is basic osteoarthritis, you use topical kinkies,
all right,
MSM. You smear that stuff on like cream cheese. You just kind of wring your hands in it, and if it works in 15 or 20 seconds, then you're going to know it's the right thing. Okay, we are talking seriously fast. It works just as well on the feet. It works just as well on the ankles and shoulders. Now, why does this work and how does it work? MSM is a free radical scavenger. It's an antioxidant as well as an anti-inflammatory. So it's dealing with the precursors. It's dealing with the reason why you have inflammation. Well, what else do you have to do? Mm-hmm. Well, gee, I've got terrible discs in my back. Well, everybody does. Join the club. But what do you do to roll out of bed in the morning? Well, it may take a proteolytic enzyme. Okay, well, what's that all about? So I'll use bromelain. Stuff is cheap, it's easy, but you take it in the middle of the night. That way when you wake up in the morning, you bounce out of bed and you feel pretty darn good. It's sort of inconvenient, but it beats the heck out of moaning and groaning all day long. So what else do you do? Well, it depends upon what's causing the underlying problem. So if you have rheumatoid arthritis, okay, one of the places that you start with this is with vitamin D. You want to get your vitamin D levels up. You need to make sure your cortisol levels are up. Why? Because typically when people are treated for these arthropathies, they're given prednisone. They're given it over and over and over again. This shuts down the adrenal glands. You end up with adrenal failure, and now you're screwed. You ache all over. What do? Blood work. We're looking for cortisol. We're looking for AM pregnenolone. We're looking for DHEA, PTH, insulin. You're looking at a rather complex picture here, because once you know what you've got, it then becomes more or less of a cakewalk to fix it. Working out of ignorance doesn't work. So what do? We typically plug people up to the phlebotomist. They give me 6 or 7 tubes of blood, and we figure out what the heck is wrong.
And we have a lot of nutraceuticals at the stages of life that are just the things the doctor was talking about. But first, you've got to connect with the stages of life.
Right. So come on in. Our office hours and health store hours are Monday through Thursday, 8 to 5. Our phone number is 407-679-3337. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our website is stagesoflife.net. You can also order any of the nutraceuticals on our online store. Just click on the health store at stagesoflife.net.